everybody. I'm Mike McDermott. I'm the President and Chief Executive Officer of Mary Washington Healthcare. We're the not-for-profit health system here serving our Fredericksburg region. Our mission is to improve the health of the people in the community we serve. All of our assets, all of our success goes back to improving healthcare in our community. It's a great mission. I'm humbled to be leading that mission for Mary Washington Healthcare. So we were asked to speak a little bit today about some of the challenges we're facing and some of the challenges we faced in the last year, some of our strategic plans, maybe some of the headwinds we even see ahead here locally. And for us in healthcare, I'm going to share with you a little bit about some of the workforce disruption that occurred for us in the year 2022. That I think is actually fairly extraordinary what happened last year. Really unprecedented. I don't think many people even could forecast what was going to happen as we entered 2022. It's not just a local phenomenon. It's not just happening here in Fredericksburg. It's actually happening not just statewide, but nationwide. And so that Omicron surge that we saw as a country as we went through the holiday period of 2021 into the beginning of 2022 put a tremendous burden on healthcare services throughout the United States of America. Number of hospitalized patients was extraordinary. The demand for healthcare professionals was incredible. And I think every hospital at the same time turned to look for extra labor to come in and help their hospitals and health systems serve their communities. We did the same thing here in Fredericksburg. That created a lot of opportunity for individuals, licensed medical professionals, not just nurses, but really anybody who holds a medical license in some way to practice. So we're talking about radiology technicians, the people that run the CAT scanners and the MRI machines. They have very specific training and certifications and licenses that allow them to do the work that they do. And so a lot of opportunities for them to travel to other hospitals for higher rates of pay for periods of time. And so here in our market, we live in a market where, I'm just going to say, if you're a nurse, you were able to sleep in your bed at night and maybe travel to another hospital or health system that you hadn't worked for before. You would make about twice as much money as you used to make in your full-time job. We were paying about 3 times the rates because a third of the rate would go to the travel or contract labor company. And you can see very quickly how the economics get upside down and expenses can outpace revenues. And I think our entire healthcare industry in the United States of America felt that shock last year. It still hasn't normalized. I think it was brought on by 2 years of very difficult working circumstances for really everybody that worked in our hospitals and health systems through the pandemic. Lots of change, lots of extra friction in their daily lives. And I just think it was the breaking point that happened as we entered 2022 and that we've had to navigate as Mary Washington Healthcare, but really every health system has had to navigate going through the last year. So extraordinary pressures on acute care hospitals currently caused by this workforce crisis that we faced in 2022. As I look forward here locally, I think there's some additional headwinds we face here in our community because we already have a shortage of licensed medical professionals. We do a tremendous amount of work, and we're continuing to do our work partnering with Germanna Community College and University of Mary Washington to increase the pipeline for individuals in our community that want to pursue these careers. We have great careers in healthcare, like they pay well, you can raise families on them, and you have a noble purpose. You're helping people when they're sick. And so it's not hard to find people that are attracted to these careers, but the pipeline isn't big enough. And so we're funding extra educators and trying to increase the pipeline to have individuals pursue these careers here in our community. But we have additional headwinds with the opening of the new VA outpatient clinic that's going to open. And I'll say, for me personally, as I drive down 95 now, and I glance at that building, we all knew how big it was going to be. But if nobody's driven by it and glanced at it, it takes my breath away because I just picture all that square footage with all the licensed medical professionals that need to work in there. It's an outpatient facility, not an inpatient facility like a hospital, but still there are going to be a lot of medical careers and a lot of opportunities for individuals in our community with that new VA outpatient center. The largest VA outpatient center in the United States of America is opening right here in our Fredericksburg region shortly. And so That's my spiel. I think I kept it within time, but I'm happy to answer any questions anybody has when it